I was experiencing homelessness. COVID did not help these things, it made it quite hard. But I was basically living in a tent in the dunes and couch surfing where possible, but mainly totally on my own on the streets, which was really scary. Family breakdown of a prior relationship with children and separating my role as a primary caregiver and then not being the primary caregiver was quite overwhelming because I've had always, have many children and have always busied myself with being the mum of the house and, all of the roles that takes on. So that family breakdown and not being that primary caregiver anymore was pretty well much what led me into kind of depression and then homelessness. And then COVID just skyrocketed it and made it so much a reality that I couldn't find my path anymore. My path was definitely lost. And then with some supports in the local community, I was directed here to the hub. And that's where my new pathway began. Even before I physically got here to the hub, when the call was made with some of my other social worker supports from other areas in the community, the level of support had begun on the phone call of just to even make an appointment for an intake. It was a lovely lady, Andy. She didn't let me be stressed with, am I eligible, how do I get there, how much is it going to cost. I was given great support and nurturing to just get here, and then basically everything was laid out very simply, very, very supportive, as in, okay, this is what you have your own room, you have your own toilet and shower, you have a small fridge and a TV, so those creature comforts were quite luxurious after surviving in a tent in the dunes with no power and much warmth. And so to be in a safe, dry, environment with these basic needs at my disposal immediately began to lift the heaviness that was on my shoulders. From the minute I got here, I felt like a kid in a new school at first, which was really overwhelming because I'm in my mid-40s now and I'm a grown adult. And so when you have to when things have been the wonderfulness of life, good things require hard work and constant maintenance. And even though I'd lost my way off my path, as soon as I got here, I'd already started to see the light at the end of the tunnel. And then each day, I just took it day by day here. But knowing that I could talk to anyone at any time of the day, not so much the residents, because we're all in the same pool of water, but knowing that you could talk to a staff member about something private, something not private, but just knowing that you could use them as a sounding board and also a stableness of help give you perspective. So when I had times of trouble, I could just approach any IFYS staff worker, and I was more than guided and always walked away feeling happy that I was vulnerable enough to put my hand up or to ask the question. It was like a big, safe mother and father nest, It nurtured me, it supported me, it also gave me discipline. So I'm really, really grateful that I did attend the program because I was very doubtful at first, but upon coming here, giving it a go, and being patient, most importantly, being patient and just that it's a really good program, and if anyone's out there struggling, that they should definitely give them a call and if you want to get back into the light, then the Pathway program is definitely the way to go.
I was homeless and I was an alcoholic, and it was pretty crap, and the only place I could get into was some dreadful place in Maryborough. And I was only there a week and I got a phone call to come here, and I just, had to buy a train ticket and come down here because that place was awful. and they didn't care for you or anything. It was just like warehousing, and they were all goddamn drug addicts, you know, so it was an uncomfortable place for me. And so I came here, and it was really good, you know. Had to sober up, and that was a bit difficult, you know. It took me, I don't know, a few weeks, and because I didn't have any medical help or any sort of help at all at that stage, because in my own head I didn't know what I was doing. And so coming here and having somewhere safe, and that was important, you know, the safety of this place. Everyone can just work out their own things in their own time, and they give you that. And so, you know, once I sobered up, I talked to staff and asked for help, and I got it from lots of people, you know, from Hank, from Karen, from Dave especially, because a couple of times I messed up and went out drinking, and other people wanted to kick me out, but Dave said no. Then, you know, once I talked to staff and told them my problems, it was like a weight off my, shoulders. It was really good, and I was able to get specific help. Alcohol counselling, made a sobriety plan with the counsellors, savings plan, you know, just things to have a normal life. And I'm really grateful that, you know, I had this opportunity and that people looked after me. And that was a big thing. I think that people cared. And they cared for everyone. And that's, you know, a lot of work for the staff, but somehow they managed to do it.
It was a pop-up program in the midst of COVID. Department of Health said, lock down everyone. Department of Housing said, well, what about the homeless people? And as a result of that, this place was popped up in short time, and people that were homeless and on the streets had a place to be, particularly in that COVID time of complete lockdown. And it's definitely journeyed from there, but that was the initial start to how the Housing Pathways program has initially started. Once they enter through our doors for the first time, we'll complete an intake with them, get to know them, get to understand what their barriers to housing has been. In many cases, that initial time, they're under a lot of fatigue. They've been sleeping rough, whether it's in their car or on a park bench or on the beach. At that time, we just really need a lot of their basic details and really encourage some rest for a short period of time. From there, we get to know them. They will be allocated their own worker, and that's really important that the worker can support them individually, get to know their story, and work on what those barriers are and how we can move forward in a strength-based way. There are many faces of homelessness on the Sunshine Coast now. I guess traditionally you would maybe equate it to long-term unemployment or addiction. That's not just the case. There's a lot of people affected by rental crisis, affected by the amount that rent prices have gone up. We're working with a lot of people that actually have a lot of qualifications and life experience, but for a few of those reasons have got themselves here. There are people that have a lot of health issues. There are people that have just been let go by their family. So homelessness is multifaceted on the Sunshine Coast. During their time they spend with a resident, and that can be quite creative. We want to be able to spend some time with the resident in a place that's a safe environment for them. We understand the barriers that they're facing, and we work in a trauma-informed way. So we pride ourselves on understanding or attempting to understand what they're going through and working on supporting them in a strength-based way. What I am so proud of my staff about It's just their unconditional positive regard that they give each of the residents they work with day in, day out. The staff are great at active listening. They are wonderful at extracting what is positive about these residents' lives, and even if the resident can't do that themselves. And that is a strength-based way of working alongside a resident. They are fantastic at the empathy, and that's the most important thing in so many ways. Solution focus is a big thing, working on what the solutions could be, not what the deficit is. A housing outcome can be quite a few different things. We've seen people get a housing outcome through employment and be able to be employed and housed at the same time, whether it's away from here or on the coast. We have seen family reintegration, which is wonderful, where a person can return to family and reunite with loved ones, and that can be a housing outcome. We've also seen many tenancy skills improve, and that can also lead to sustainable housing for the future. So we have 60 on-site positions within the Housing Pathways program, and the turnaround, as soon as someone leaves, there's normally someone in that day. So the need is there, and we are working, our staff are working with 60 of the residents at any one time.